Hello everyone, I hope you're having a fabulous day. I am Dr. Megha and I'm a consultant pathologist and I work with Proactive for Her. Today I'm here to talk to you about the COVID-19 vaccination and also to help you understand COVID-19 lab reports. Well, on May 1st, the program is being rolled out so that everyone over the age of 18 all over India can get the COVID-19 vaccination. So now, how would you register yourself? Well, download the Arogya Setu app or log on to the www.covid.gov.in website and register yourself. You'll have to provide your phone number, following which an OTP will be generated. You'll also have to provide a photo ID proof. Enter your PIN code and depending on your location, all the places around you where you can get vaccinated will be generated. Choose a time slot and make sure you turn up on the date that you have been allotted. When you go for the vaccination, make sure that you're also carrying the photo ID proof which you use to register yourself. One of the questions that keep getting asked is, Doctor, what are the vaccines available and what should the time interval be between the first and the second dose? At the moment in India, we have Covaxin and Covishield. If you're taking Covaxin, the time interval between the first and the second dose is between 4 to 6 weeks. If you are taking Covishield, the time interval between the first and the second dose is between 6 to 8 weeks. Well, there are questions regarding whether the first and the second dose should be of the same brand. Yes, absolutely, it is necessary. If you take Covaxin the first time around, make sure to take Covaxin for the second dose as well. Covishield the first time, Covishield the second time. There are some concerns also regarding whether if you get vaccinated, you can get COVID-19 through the vaccination. Well, the answer for that is no. They are not injecting the coronavirus into your body through the vaccination. So you will not get COVID-19 per se, the vaccine. Then there are questions whether the person who gets a COVID-19 vaccine should get isolated. Answer is absolutely not. The COVID-19 vaccination is not causing the coronavirus to enter your body, so you do not have to get isolated. If you are not infected, why should you get isolated? Okay, another commonly asked question is whether someone who has had COVID-19 in the past should get vaccinated. Yes, if you've had COVID-19 in the past, you still should get vaccinated so that you have sufficient immunity. Another frequently asked question is whether someone who has had COVID-19 vaccination will get the COVID-19 infection. Well, the answer is it is possible that you may get the COVID-19 infection in spite of the fact that you have been vaccinated. But the advantage of getting the vaccination is that you are protected against getting a very severe form of the disease, or you may not require hospitalization. That is where the vaccination protects you. Okay, another question that we get is how soon after getting the vaccination will the protective effect of the vaccine kick in? After you get the second dose, you will have to wait for about 14 more days to make sure that your immunity is on point and that you are sufficiently protected. A lot of women folk ask me whether they can get the vaccination when they're on their periods. There has been some bogus rumors which have gone out saying 5 days before, 5 days after periods, on periods don't get your vaccination. That is not true. There is no correlation between your periods and the vaccine immune efficacy. So when your turn to get the vaccine comes, irrespective of your period status, please go ahead and get your vaccine. Can pregnant mothers and lactating women take the vaccine? Well, as of now, the answer is no. The government, the Ministry of Health and Family Welfare does not recommend that pregnant and lactating women get the vaccination. Well, another common question is, does the vaccination affect the fertility? Absolutely not. There is no connection between fertility and this vaccine at the moment. So you do not have to worry about it. If you are planning to conceive later on, this vaccine is not going to affect your fertility. So go ahead and everyone should get the vaccination. Well, moving on to lab reports. RT-PCR or reverse transcriptase polymerase chain reaction is one word which has become integral to our daily vocabulary in the last 1 year. So when you get an RT-PCR done for COVID-19, what are you looking for? First, you're going to see whether the report is positive or negative. If it is positive, you will also look at the CT value, which is C for cycle and T for threshold. That is a cycle threshold value. This refers to how hard the test had to work to find the virus. In simple terms, I would explain it as, if you had a lot of treasure in one room, it would be really easy for you to find it. So the same way, if there was a lot of virus in your body, the test would quickly pick it up. So the test, the CT value and the viral load is inversely related. So if the test had to work very hard to detect the virus, that would indicate that you have a low viral load. If this test was able to rapidly find the virus, then you have a high viral load. So these two are inversely related. The implications of this is only with regard to the transmission capacity. So if you have a high viral load, you would be able to quickly infect other people. Some of the other parameters in the lab reports which would be important for a doctor is the markers of inflammation. As you understand that COVID-19 also causes inflammation in our body. What it causes is unregulated or dysregulated inflammation, which causes most of the ill effects of the disease. So what are doctors and scientists doing? They are using something called as markers of inflammation. So using these markers of inflammation, they would be able to understand how much inflammation is present in your body or how badly the body is inflamed. So some of the commonly used markers of inflammation are the CRP, it is expanded as C-reactive protein, D-dimer, interleukin, ferritin and LDH. So there would be a normal range for this and there would be an increased range. So depending on which lab and what kind of units they are measuring it in, the normal range and the increased range would be different. For instance, like centimeter and meter. So depending on the kind of units these labs are using, the values would also be slightly different. Well, CRP, the recommended range is that if it is under 10, it is normal. But when it is increased for over more than that, it is significant, especially when it goes over 100. Values like that would be of prognostic and diagnostic importance. It's not just one value of these tests, but you would have to do multiple readings will be required to understand the trend. So on day 1, it was this. After day 2, day 3, day 4, what is the trend of these markers of inflammation is important for the doctor to see and understand. For instance, if there were 2-3 patients on the first day when they were admitted to the hospital, they all looked quite similar. But the patients who had increased markers of inflammation on day 1 are the ones who are likely to progress adversely over the coming days. Another parameter which is of interest is the CBC or complete blood counts. What we are seeing is that in COVID patients who are likely to get more sick, there is a reversal in the normal ratio of neutrophils and lymphocytes. Normally in our body, the WBC, the white blood cells, in these WBCs, you have something called as neutrophils and something called as lymphocytes. Normally, the neutrophils would be more than the lymphocytes. But in patients who have moderate to severe disease, we are seeing a reversal of this ratio. Instead of neutrophils being more than the lymphocyte, we are seeing that the lymphocytes are increased. We are seeing lymphocytes are increased and the WBC count is also reduced. Well, that's all for now. We'll meet again, and until then, stay proactive about your health, stay safe and get vaccinated.